Welcome. In this video, we'll discuss what psychotherapy is, discuss some statistics related to psychotherapy, talk about how to find a therapist and what type of therapists there are out there. Sometimes when discussing therapy or psychological disorders, it can be a triggering event. Please know that there are people out there to help you. At OCC, we have mental health services that are free to students. You can leave a voicemail or text the number that's listed on the slide. 988 is now the National Suicide Hotline, and there's also another suicide prevention lifeline listed here as well. There have been many forms of therapy that have been developed to treat a wide array of problems. So these Marines here are on a beach at Camp Pendleton. They served in Iraq and Afghanistan together with mental health volunteers. They're part of an ocean therapy program at Camp Pendleton. It's a program in which learning to surf is combined with group discussions. The program helps vets recover, especially vets who suffer from PTSD. Approximately 19% of U.S. adults experience mental health in a given year. The percentage of adults who receive mental health treatments in 2004 to 2008 is shown in this graph here. Adults seeking treatment increased slightly from 2004 to 2008. It looks to be around 13%. And I would say that it's probably increased even more now in 2024. Approximately 13% of adolescents aged 8 to 15 experience mental illness each year. About 1/3 to 1/2 of those adolescents with mental disorders receive treatment. Behavior-related disorders are more likely to be treated. So this graph is showing the percent with the disorder, the type of disorder. Adolescents age 18 to 15, we have anxiety disorders, mood disorders, conduct disorders, ADHD, and then any other disorder. So it's important to know how to find a therapist. I'll link the APA Psychologist and Psychology Today's Psychologist Locator on the Canvas page. You can also get mental health services at OCC to get a referral or use OCC mental health services yourself. Now, when you're looking for a therapist, ask for a short, should be free, consultation, and ask them the following questions. Of course, feel free to add your own as well. First, you want to know, are they a licensed therapist and what kind of license they have? So anyone can kind of hang a shingle and say, I'm a therapist, but you want to make sure that they actually have gone through the training, that they have a license, which means that they've gone through a large number of hours supervised by an experienced therapist before you go to talk to someone. You want to say, I've been having, XYZ symptoms or XYZ problems. What type of experience do you have helping people with these problems? So you want to know, for the problems that you're experiencing, do they have experience helping those individuals? What are your areas of expertise? For example, children, adults, be specific. What about your age, your demographics, those types of things. You want to ask them, what is their approach to therapy and what type of treatments do you use? So we'll talk in some subsequent videos about different approaches to therapy. And so after you watch those, you'll have a more educated understanding of the answer to that question, but it's important to understand how they're going to approach your therapy sessions. You also might want to ask them what a typical session looks like so that you know, is this kind of what you're thinking you want? Ask them how long a session is. They're typically about an hour, so 45 minutes to an hour, because they have to have transitions between patients. Ask them what the cost is. Do they take insurance? And I'll also provide a link on the Canvas page to how to choose a psychologist from apa.org. Now, one of those questions was about the type of license that they have. We'll briefly discuss the different types of licenses you may see from a therapist, just like you see at a medical doctor's hanging on the wall when you go in. So one of those questions I suggested asking when you're looking for a therapist was about the type of license they have. So we'll just briefly discuss the different types of licenses you may see from a therapist. So just like you see a medical doctor's license hanging on the wall when you go in for your physical or whatever is ailing you, you want to see a therapist license too. So clinical social workers, or LCSWs, have a master's degree in social work from an accredited university or institution. After receiving their master's degree, they complete about 2 years and a number of hours specified by each state under the supervision of an already licensed social worker, and then they pass a licensing exam. Counseling psychologists that are licensed in California have completed a master's level program in psychology, focusing on clinical aspects of psychology. In addition, they complete 3,000 hours of supervised clinical work, and they take a licensing exam. So these individuals are going to work with individuals, couples, families. They can work with groups, and they address a variety of mental health issues that their clients might be facing. They're able to diagnose and provide treatment plans, apply appropriate and evidence-based therapeutic treatments, and the degrees in licensing vary, but here in California, we have a marriage and family child counseling, or MFCC, a licensed marriage family therapist, or LMFT, and then a licensed professional clinical counselor, LPCC, are quite common. The LPCC, my understanding, is more common in other states across the country. Clinical psychologists have completed a PhD or a PsyD program. Now, PhD programs have a heavy focus on research, while PsyD programs focus on the clinical approaches to treatment. Very different types of graduate programs, but in the end, both are able to diagnose and treat mental disorders, including more severe disorders like schizophrenia. Psychiatrists are actually medical doctors, and they can do the same thing as clinical psychologists, but they're also able to prescribe drugs. In some states, clinical psychologists can prescribe drugs, but in most cases, they refer patients to psychiatrists when drugs are needed. And that is also sometimes just what psychiatrists end up doing, is prescribing drugs and not really focusing on the therapeutic aspects. So now you have a little bit more of an educated idea about the types of therapists you might encounter if you are looking for a therapist. And in subsequent videos, we'll talk about different approaches to therapy.